All right, sorry. Hello. Okay. All right, everybody, we're on for our next talk. I'm going to introduce Victoria and Juan with the Community Health Profiles. If we can give them a round of applause.
Oh, we're just talking into here, right? Okay. Cool. This one? Okay.
Whichever one you want, but you could use that.
Okay.
It's better for the cameras.
You might have to raise it a little. No, I'm just kidding. Hi, everyone. Welcome, and thank you for joining us today. My name is Juan Cardenas, and I am a GIS analyst with the Internal Services Department. I'm joined here today with...
I'm Tori Elmore. I'm a senior GIS analyst with the Department of Public Health.
And today we're excited to present our work on the Community Health Profiles, which is a project aimed at making health equity transparent. So here's a quick little agenda about the presentation today. We have 5 sections: the about, development approach, the build, and impact, and if we have time, a little Q&A. All right, so background. In 2018, Los Angeles County released the City and Community Health Profiles, which was a comprehensive health report aimed at providing essential health metrics across various communities. It was primarily distributed as a static report, and the report included extensive data on chronic diseases, health behaviors, environmental health, and healthcare access. But without interactive features, it was challenging to explore and interpret efficiently. As a result, users expressed the need for an interactive tool that would streamline navigation and support real-time data exploration and provide more engaging visuals. So the audience for this report included a diverse range of groups and individuals, each with unique needs and goals. Let's take a closer look at who we were designing this project for and how their needs shaped our approach. We had community organizations and advocates whose health data support initiative addressing health disparities with accessible location-specific information. County analysts and Board of Supervisor analysts who relied on accurate health metrics for quick decision-making in policy and resource allocation. We had researchers and academics who used detailed and reliable data from the reports to study health trends and support analysis. And last but not least, and maybe the most important, right, is community members and the public. They access the reports for simple insights to better understand their community health conditions. As we gathered feedback from these users from the 2018 report, there were several key areas that were identified for improvement. Users expressed the need for more maps and visualizations. Maps were the top request as they allowed for a more intuitive understanding of health metrics by location. Increased interactivity. Users wanted the ability to explore data in real time, to customize views, and analyze trends without having to sift through tons of pages. And broader data integration, right? There was a demand for more data sets to give a fuller picture of the health in each community. And just overall reduced manual effort, right? These are PDF reports. It required a lot of manual work for users to analyze and interpret the data, right? So they sought a platform that could streamline this process, right? So the feedback made it clear. Our audience needed an accessible, dynamic, and interactive tool. This valuable input from our audience directly influenced the approach and development goals for our current project, setting the stage for a solution that aligns with user expectations. So here we go into the scope. Okay. So scoping began around May 2023 with a goal to transform how health data is accessed and utilized. We adopted a hybrid model combining ArcGIS tools with custom development to ensure flexibility and interactivity tailored to our audience. The platform will integrate over 400 interactive maps and 4,000 infographics, providing a clear, actionable insights. The final scope expanded significantly to include 101 feature layers, 5 apps, 54 maps, and a custom dynamic infographic report, meeting our diverse user needs effectively. To bring this ambitious project to life, we assembled a highly skilled, multidisciplinary team. Each team member contributed unique expertise that was essential to the project's success. We had public health leadership, which directed the project to align with strategic goals and public health priorities. We had a GIS project manager with coordinated teams, managed timelines to keep the project on track. We had GIS developers who built the platform's technical backbone using Python and JavaScript. GIS analysts who focused on mapping, product support, and quality control, ensuring data accuracy. We had public health communications team, which developed style, branding, and accessibility. The epidemiology team provided community-specific health data and analysis. The public health executive team offered high-level guidance. And the Esri Advantage program team, which provided advanced ArcGIS support and customization. Together with this team, we combined their expertise to build a truly powerful platform. Lastly, the cycle, right? So we adopted a bi-weekly sprint cycle, an agile method, starting in August 2023 to ensure flexibility and responsiveness to evolving needs. Each sprint kept us focused, allowing for steady progress, with sprint reviews to demo progress and gather feedback. We used Azure DevOps for task tracking and Microsoft Teams for collaboration, combining structured tools and regular assessments to stay agile and make sure to deliver on target.
Thanks, Juan. Next, I'm going to discuss how the platform was built, including creating and managing the data, building the data visualization and exploration applications, and sharing the end products with users. The core data for this project is the 101 indicators. Indicators are health-related metrics. They include direct measures of health conditions, such as HIV prevalence rate, demographic metrics, such as median household income, environmental factors that affect health, such as proximity to point sources of pollution, metrics about behaviors that affect health, such as the percent of adults reporting binge drinking, and measures of healthcare access, like percent of children without health insurance. The majority of these indicators were calculated for 6 geography types: the county as a whole, 5 supervisorial districts, 8 spas, 210 cities and unincorporated communities, 139 Los Angeles city neighborhoods, and 12 LA City Council districts. The indicators are organized into 11 themes, such as behavioral health, environmental justice, and community safety. Our team received 12 tables of data from the Office of Health Assessment and Epidemiology, containing data and metadata for all 101 indicators. We developed Python scripts to join indicator data to the spatial data, representing our 6 geography types, and creating the 101 feature classes in ArcGIS Pro. We also added complete and standardized metadata to each feature class, things like thumbnails, summary, description, tags, use constraints. We published all 101 feature classes to ArcGIS Online as hosted feature services, and we also use those Python scripts to modify and update both data and metadata in AGOL as needed. As if the 101 feature layers weren't enough, building the various components of the Community Health Profiles platform also required a large number of data visualization products, mostly maps, but also graphs and charts. The primary mapping platform is powered by 44 web maps, with 4 maps across the 11 themes, each map representing a different geography. We created another 10 web maps for the map comparison tool, and cartographers on the Enterprise GIS team fully built and styled 1 map per theme, and then we used Python to help create the remaining 43. Finally, the Enterprise GIS team designed a fully custom report featuring both maps and graphs using JavaScript, HTML, and CSS. Here's a quick peek behind the scenes on automation. Because this project has so many assets, the ArcGIS API for Python was an indispensable tool, which we used for creating and duplicating the web maps that powered our applications, modifying layer definition properties like symbology, pop-ups, and filters, and then publishing changes to the indicator data and metadata made by the public health project team during the project. So here's what the platform looks like. We used Experience Builder to create an interactive platform designed for exploring the 101 indicators. Each geography has its own application, but the individual apps are linked so the user experiences the platform as if it were a single application. Each app has 33 different views, an about view, a map view, and a report view for each of the 11 themes. A filter widget updates the map and report views to highlight a single community like a spa or incorporated city. The map comparison tool is another Experience Builder application which provides users with the ability to directly compare any two indicators across any theme side by side. And finally, the report is a fully custom web page built with JavaScript. It dynamically filters content both geographically and by theme, compiling all indicators or all indicators in a given theme for a single community, like Spa 8 or the city of Santa Monica. It works as both a standalone site and as content embedded into Experience Builder. And for folks who really liked those 2018 PDFs, users can also print reports as PDFs. All of the applications come together on the DPH Hub site, which also features narrative information about the project, methodology documentation, feedback forms, and help resources, such as instructional videos for navigating the applications. It contains links to the county's open data site where all of the indicator data is available to download. Okay. Let's talk about the project impact. So we held a launch event in South LA at the end of April. Community members, including staff from community-based organizations, were in attendance. It was really exciting to see how excited people were about the data and how they might put it to use. Since the launch, we've been contacted by users with a full range of questions, feedback, and requests. For example, within the county, a presentation was requested and delivered to the Sustainability Council and the Strategic Planning and Sustainability Office at the Department of Public Works, whose focus was on linking sustainability to health outcomes in communities. Outside the county, the Beach Cities Health District contacted the CHP team to request support aggregating data to their whole health district, which they're using to compare local health outcomes with county-level indicators. Nonprofit news organization Cal Matters is using the CHP data in an article linking air pollution with asthma rates. So here's a high-level breakdown of what it took to bring this project to fruition. Juan already talked about all of the people involved, but just to go over kind of like the costs. So the Department of Public Health contracted the Internal Services Department for approximately 650 hours from the Enterprise GIS team, in addition to the time that our epidemiology and GIS teams and other programs spent supporting the project. We spent 50 Esri Advantage credits, and of course there's the costs associated with maintaining licenses in the county's ArcGIS online account. In terms of how we're keeping tabs on our project assets, we're using the ArcGIS API for Python to track layer, web map, and application views, which give us a sense of which assets are most popular and in demand. Some highlights include more than 35, actually I think we updated these numbers. Well, I think these numbers are actually now almost double that. So 60,000+ app views, with cities and unincorporated communities application being the most popular, and 40,000+ hub views across all of our project page. We're also using Google Analytics to keep tabs on our custom reports, and I think this number's been updated as well. Last I heard was about 1,200+ unique report viewers, most of those who are coming from inside LA County. Last piece here, just looking to the future. There have been a lot of ideas for next steps and updates. like a mobile-friendly version of the web mapping platform. If anybody's trying to open it on your cell phone, it's not going to work. So keep an eye out. That's something that's definitely been discussed. More customizable reports and the inclusion of additional indicators. For now, we're focusing on developing a data update strategy with a focus on automation, bringing more DPH data and initiatives to the hub site, and building an analytics dashboard for project assets. And we'll just wrap it up. I included a quote here from the contracts and grants manager at a local community-based organization. I'm not going to read it out loud, but to summarize, the Community Health Profiles project is providing individuals and organizations across LA County with the data that they need to attract funding, influence policy, and effectively communicate the state of public health in their communities. Yeah, thank you.
And you could scan the QR code if you want to see what it is that we're talking about. It takes you to the hub page. So go ahead and scan that QR and take a look. But like Tori mentioned, the apps aren't mobile user-friendly yet. So
The report is user-friendly, so if you want to check out an aspect of the report or aspect of the project on your phones, you can go to the reports.
I see at the end you said that it will be updated over time. Are there any types of analysis that long range you were looking forward to being able to do that with a larger data set? Or is it just kind of the update the components that are already existing?
Yeah, so I think like the primary goal of the project is to take like a lot of the data that we have either accessible to us, and we have a team of GIS analysts, data scientists, et cetera, and kind of provide that to the public in a user-friendly way. And so having all of that data in the open data portal means that, without any GIS experience, somebody can go in and download that data as CSV files. They can create a web map of their own without, any GIS experience, et cetera. And so keeping that updated is really important to us. And then also some of that data that's in this, and I think in some ways some of the most valuable data is data that was analyzed by our DPH programs. So they took something from American Community Survey and they either conducted some type of analysis or they aggregated it in a way that would be more meaningful to communities. But I would say that the primary goal of the project is to make the data itself accessible to users. I'm sure within our programs, the audience for the project is the public, but it's also internal users in the Department of Public Health and in other departments in the county. So I think what we're really excited about is to kind of see how those users are taking the data and using them to serve their own analyses. There have been folks who have reached out and said hey, can we get some help doing this with the data or doing that with the data, which is also amazing to hear because it helps us keep tabs on what people want and what they're doing with the data. But yeah, I guess that's a long way of saying that internally, our team doesn't have a specific list of analyses, but more an interest in helping other people do their analyses by making this data available all in one place and in a variety of highly accessible formats.
All right, thank you so much, Department of Public Health. Before to give you guys a quick pick. Just stand on the other side of the dot. Juan. Thank you guys. Great job.
Awesome. Good, how are you? Good. All right, let's see. So you are going to